Hello again. As Europe's largest employer, it will come as no surprise to hear that the greatest item of expenditure for Britain's National Health Service is the wages bill. It is astronomical and growing day by day. The salaries paid to cleaners and porters are modest enough. It's the doctors, especially these surgeons and consultants, whose wages really drive up the amount spent. If only a way could be found to get by with fewer doctors, it would be easier to get the books to balance. This is a serious problem. Something else which has been irking the NHS for a few years is the ethnic composition of its workforce. It's not that it is not mixed enough. As anybody knows who has used a hospital in the last few years, it's like the United Nations these days. The difficulty is not that there are not enough black people, those of South Asian heritage and various foreigners working in hospitals and health centres. It is the proportion of ethnicities at different levels. You see, at one time it was enough to prove that you had a bunch of black people working for your organisation which roughly corresponded to their percentage in the general population. Often, though, this meant that a company would be able to claim that they had the correct proportion, but it would later transpire that all the black people were very junior staff or cleaners or something, and all the important jobs were occupied by white people. These days, you need to show that black people are in the important jobs as well as the more lowly ones. In the movie industry, this is a really big deal at the moment. If you want your company to get on and be accepted and get contracts, then you must demonstrate that you have black partners, black actors, black people right at the top jobs, as well as doing the more menial things. In the NHS, there are, of course, plenty of black staff, but many of these are porters, security guards, cleaners, and nurses. Hardly any are doctors, and this is very noticeable. And it was decided a while ago to try and do something about it. The problem is that medical schools in this country are ferociously competitive and require 3 or 4 A levels at A star if you have to have any chance at all of getting into medical school. For whatever reason, few black teenagers have those high scores at A level, and so they seldom get into medical schools in this country. The solution to both these problems, that is to say the wages bill and the lack of black staff at higher professional positions, turned out to be a very simple solution indeed. It entailed expanding and encouraging the creation of so-called physician associates, a profession which is supposed to be able to take over a lot of the routine work done by doctors. Those training to be physician associates don't need top A levels. Indeed, they don't need any A levels at all. They need to have a degree in a relevant subject, but this doesn't have to be a first, nor does it have to be from a Russell Group university. If somebody has managed to scrape by with a second from Greenwich or London Metropolitan, then that's enough for them to be able to train as a physician associate. After a 2-year course, these people can make diagnoses, take blood, in fact do a whole lot of stuff which only doctors used to be allowed to do. The great advantage is that physician associates are much cheaper than proper doctors. And also, a lot of them are black. 2 birds killed with 1 stone, you see. These people can be listed as healthcare professionals, and they bump up the number of professional staff who are black, which looks good on the monitoring forms, and they cost less than real doctors. Indeed, some surgeries and hospitals are now quietly reducing the number of genuine doctors they employ and using physician associates instead. This is visually very impressive, for it means more black people wearing white coats with stethoscopes around their necks, and it cuts costs too. What's not to like? Of course, doctors are fighting this trend because it means that there is less demand for them. which is, I suppose, quite understandable. I give a link to a motion recently passed by doctors which warn that this trend compromises patient safety, which is almost certainly true, but they're fighting a losing battle. The British Medical Association has issued a statement expressing their concern because physician associates are not actually regulated in the way that doctors and nurses are. That there is something curious going on may be seen when you look at the statistics for the ethnicity of physician associates, to which I also give a link in the description to this video. In most professions, and I'm thinking now of solicitors, architects, pharmacists, opticians, engineers, and so on, the ethnic breakdown shows lots of Indians and white people, but very few black people. Never mind why that should be, it is the case in practically any profession you look at. With the ethnicity of physician associates, on the other hand, you'll find that there is a higher proportion of black people than those of South Asian ancestry. This is very unusual, and it shows us at once that something is going on. We're going to be hearing a lot more about physician associates in the coming months because there's a lot of concern about their taking over the work usually carried out by actual doctors. It has been said in some hospitals that it's a matter of time before there's a serious incident. Patients, by the way, are not being kept in the loop about all this, and many people have had a blood sample taken or a diagnosis given without realising that the person with whom they are dealing is not really a doctor at all. This is an interesting situation, and it's likely to be quite a fast-moving one in the next year or so, and I shall keep you as posted on any further developments.